Question 1. Market research demonstrates that post-anesthesia nurses frequently encounter patients exhibiting subtle signs of respiratory compromise. A patient recovering from general anesthesia is noted to have shallow respirations, a slightly decreased oxygen saturation, and occasional paradoxical chest wall movement. The nurse suspects early airway obstruction or hypoventilation. Which of the following approaches best reflects optimal process optimization for managing this situation? Option A. Document the observed changes in the patient's chart and proceed with other patient care tasks, assuming the patient will spontaneously improve without direct intervention. Option B. Immediately reposition the patient to a semi-Fowler's position, assess airway patency by observing chest rise and fall, and administer supplemental oxygen via nasal cannula as per protocol, while simultaneously notifying the anesthesia provider of the observed changes. Option C. Continue routine vital sign monitoring and wait for the patient's oxygen saturation to drop below 90% before initiating any interventions or notifying the anesthesia provider. Option D. Administer a prescribed opioid reversal agent to address potential residual sedation contributing to hypoventilation, without first assessing airway patency or oxygenation. Correct answer is B. Immediately reposition the patient to a semi-Fowler's position, assess airway patency by observing chest rise and fall, and administer supplemental oxygen via nasal cannula as per protocol, while simultaneously notifying the anesthesia provider of the observed changes. Explanation. This scenario presents a common yet critical challenge in post-anesthesia care: the rapid identification and management of respiratory complications. The professional challenge lies in the potential for rapid deterioration of the patient's condition, requiring immediate and accurate assessment, intervention, and communication. The nurse must synthesize subtle clinical cues with knowledge of potential post-anesthesia respiratory issues to prevent adverse outcomes. The correct approach represents best professional practice because it prioritizes direct patient assessment and intervention based on established clinical protocols, and the nurse's scope of practice as defined by CPAN standards. This aligns with the ethical imperative to provide safe and effective patient care, minimizing harm and promoting recovery. Promptly assessing airway patency, breathing effectiveness, and oxygenation status, and initiating appropriate interventions such as repositioning, suctioning, or administering supplemental oxygen directly addresses the immediate threat to the patient. This proactive and evidence-based approach is fundamental to post-anesthesia nursing and is implicitly supported by guidelines emphasizing patient safety and continuous monitoring. An incorrect approach that delays assessment or intervention, such as waiting for a physician's order for basic interventions like repositioning or suctioning when the patient exhibits signs of airway obstruction or hypoxia, represents a failure to adhere to the principle of timely patient care. This delay could exacerbate the complication, leading to further oxygen desaturation or even respiratory arrest. Ethically, this constitutes a breach of the duty of care. Regulatory frameworks for nursing practice, including those underpinning CPAN certification, expect nurses to act autonomously within their scope to stabilize patients and prevent harm. Another incorrect approach, such as assuming the patient's respiratory status is stable without a focused assessment despite subtle signs of distress, demonstrates a lapse in vigilance and critical thinking. This can lead to missed opportunities for early intervention, potentially resulting in a more severe complication that requires more aggressive management. This failure to perform a thorough and timely assessment violates the core tenets of patient monitoring and safety expected of a certified post-anesthesia nurse. Professionals should employ a systematic approach to patient assessment, starting with a rapid primary survey, airway, breathing, circulation, disability, exposure, and then proceeding to a focused assessment based on the patient's condition and the context of post-anesthesia recovery. This involves continuous monitoring of vital signs, oxygen saturation, and respiratory effort, coupled with a keen awareness of potential complications. When a complication is suspected, the decision-making process should involve 1. Immediate assessment of the patient's airway, breathing, and circulation. 2. Initiation of appropriate, evidence-based interventions within the nurse's scope of practice. 3. Clear and concise communication with the healthcare team, including the anesthesia provider and physician. And 4. Ongoing reassessment to evaluate the effectiveness of interventions and adjust the plan of care as needed. Question 2. The performance metrics show a slight increase in the incidence of postoperative nausea and vomiting, PON, in patients receiving a specific opioid analgesic. As a certified post-anesthesia nurse, CPAN, what is the most appropriate initial pharmacological intervention to address this trend? Option A. Document the PONV as an expected side effect and continue the current opioid regimen without further intervention. Option B. Administer a broad-spectrum antiemetic without consulting the anesthesia provider, assuming it is a common side effect. Option C. Increase the dose of the current opioid analgesic to potentially override the nausea and improve pain control. Option D. Review the patient's current opioid regimen for potential dose-related PONV effects and consult with the anesthesia provider to explore alternative analgesics or adjunctive antiemetic therapy. The correct answer is D. Review the patient's current opioid regimen for potential dose-related PONV effects and consult with the anesthesia provider to explore alternative analgesics or adjunctive antiemetic therapy. Explanation. The performance metrics show a slight increase in the incidence of postoperative nausea and vomiting, PONV, in patients receiving a specific opioid analgesic. This scenario is professionally challenging because it requires the post-anesthesia nurse to critically evaluate the pharmacological principles underlying opioid-induced PONV and to implement evidence-based interventions while adhering to patient safety standards and institutional protocols. The nurse must balance the need for effective pain management with the prevention and treatment of adverse drug effects. The correct approach, which involves reviewing the patient's current opioid regimen, considering the mechanism of action of the opioid in relation to PONV, and consulting with the anesthesia provider to explore alternative analgesics or adjunctive antiemetic therapy, represents best professional practice. This aligns with the CPAN responsibility to monitor patients for adverse drug reactions, understand pharmacodynamics and pharmacokinetics, and advocate for appropriate patient care. It is ethically mandated to provide safe and effective care, which includes minimizing harm from medications. This approach is supported by the principles of pharmacotherapy and patient safety guidelines that emphasize individualized treatment and proactive management of side effects. An incorrect approach would be to simply increase the dose of the opioid to overcome the nausea, as this fails to address the underlying pharmacological issue and could exacerbate other opioid-related adverse effects, potentially violating patient safety regulations and the ethical duty to do no harm. Another incorrect approach would be to ignore the PONV, assuming it is an expected side effect, which neglects the nurse's responsibility for vigilant monitoring and intervention, contravening professional standards of care and potentially leading to patient distress and complications. Furthermore, independently administering a different class of antiemetic without consulting the anesthesia provider could lead to drug interactions or contraindications, posing a significant risk to the patient and violating collaborative practice guidelines. The professional decision-making process for similar situations should involve a systematic assessment of the patient's condition, a thorough understanding of the pharmacology of administered medications, identification of potential adverse effects, and a collaborative approach to intervention. This includes reviewing patient history, current medications, and diagnostic data, followed by evidence-based problem-solving and communication with the healthcare team to ensure optimal patient outcomes. Question 3. Implementation of a post-anesthesia care unit, PACU, assessment for a patient recovering from a lengthy surgical procedure. The certified post-anesthesia nurse, CPAN, is prioritizing the identification of potential integumentary system complications. Which of the following assessment strategies best reflects a proactive risk assessment approach for the integumentary system? Option A. Performing a visual inspection and palpation of the entire skin surface, paying close attention to bony prominences, areas of potential pressure from positioning devices, and the surgical site for any signs of redness, blanching or non-blanching, moisture, or breakdown. Option B. Relying on the patient's self-report of comfort and absence of skin pain as the primary indicator of integumentary integrity. Option C. Documenting the condition of the surgical incision only, assuming other areas of the skin are unaffected unless specifically reported by the patient. Option D. Reviewing the surgeon's operative report to confirm the absence of any pre-existing skin conditions noted prior to the procedure. The correct answer is A. Performing a visual inspection and palpation of the entire skin surface, paying close attention to bony prominences, areas of potential pressure from positioning devices, and the surgical site for any signs of redness, blanching or non-blanching, moisture, or breakdown. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to integrate knowledge of integumentary system anatomy and physiology with a proactive risk assessment approach in the immediate post-operative period. The skin, being the largest organ, is highly susceptible to damage from surgical positioning, pressure, friction, and moisture, all of which are common in the post-anesthesia care unit, PACU. A failure to identify and mitigate these risks can lead to significant patient harm, including pressure injuries, skin tears, and surgical site complications, impacting patient recovery, increasing healthcare costs, and potentially leading to litigation. The CPAN must exercise critical judgment to anticipate potential issues based on the patient's individual factors and the surgical procedure. Correct approach analysis. The correct approach involves a comprehensive integumentary assessment that specifically looks for early indicators of compromised skin integrity. This includes evaluating skin color, temperature, turgor, and the presence of any pre-existing conditions or new findings such as redness, blanching or non-blanching areas, moisture, or abrasions. This aligns with best professional practice as outlined by nursing standards of care and guidelines for post-anesthesia care, which mandate thorough patient assessment to ensure safety and prevent complications. Specifically, the CPAN is ethically and professionally obligated to identify and address potential risks to the patient's integumentary system, as this is a direct component of patient safety and quality care. This proactive risk assessment is fundamental to preventing adverse events and promoting optimal healing and recovery. Incorrect approaches analysis. One incorrect approach would be to solely rely on the surgeon's operative notes for integumentary status, without performing an independent PACU assessment. This is a regulatory and ethical failure, because it abdicates the CPAN responsibility for direct patient assessment and monitoring in the PACU. The operative notes may not reflect the immediate post-operative condition of the skin, especially concerning pressure points or friction injuries sustained during transfer or positioning. Another incorrect approach is to only document the absence of obvious surgical site complications, neglecting to assess the broader integumentary system for pressure-related risks. This is a failure to adhere to comprehensive nursing assessment standards, which require evaluating all relevant body systems for potential harm. Furthermore, assuming the patient's skin is intact without visual inspection and palpation is a critical lapse in professional judgment and a violation of the duty of care. Professional reasoning. Professionals should employ a systematic approach to patient assessment in the PACU. This involves a head-to-toe assessment with a specific focus on areas identified as high risk for integumentary compromise, such as bony prominences, areas of prolonged pressure, and surgical incision sites. The decision-making process should prioritize patient safety by anticipating potential complications based on the patient's condition, the type of anesthesia, the surgical procedure, and the duration of immobility. This involves utilizing clinical judgment, adhering to established nursing protocols, and communicating findings promptly to the healthcare team. When assessing the integumentary system, the CPAN should consider the patient's risk factors for skin breakdown, e.g., age, nutritional status, comorbidities, level of consciousness, and the potential impact of the surgical intervention and post-operative management on skin integrity. Question 4. The evaluation methodology shows that a post-anesthesia nurse is assessing a patient who received sevoflurane and fentanyl for a laparoscopic cholecystectomy. The patient is awake, oriented, and has stable vital signs, but exhibits mild shivering and a respiratory rate of 14 breaths per minute. Which of the following approaches best reflects a comprehensive risk assessment for this patient's anesthetic agents? Option A. Consult with a senior nurse about their typical post-operative management for similar cases, without reviewing the patient's specific anesthetic record. Option B. Administer a neuromuscular reversal agent immediately due to the patient's respiratory rate of 14, assuming residual effects from sevoflurane. Option C. Focus solely on the patient's level of consciousness and vital signs, as these are the primary indicators of recovery from general anesthesia. Option D. Assess for signs of residual neuromuscular blockade and consider the potential for hypothermia contributing to shivering, while recognizing that fentanyl can cause respiratory depression. Correct answer is D. Assess for signs of residual neuromuscular blockade and consider the potential for hypothermia contributing to shivering, while recognizing that fentanyl can cause respiratory depression. Explanation: the evaluation methodology shows that a critical aspect of post-anesthesia care involves the safe and effective management of anesthetic agents. This scenario is professionally challenging because the nurse must synthesize information about the patient's current physiological status, the specific anesthetic agents used, and potential adverse reactions to ensure optimal recovery and prevent complications. Careful judgment is required to differentiate between expected post-anesthetic effects and signs of a serious adverse event, necessitating a thorough understanding of pharmacology and patient assessment. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based assessment of the patient's response to anesthetic agents. This involves a comprehensive review of the patient's medical history, the specific agents administered, including dosage, route, and timing, and a detailed physical assessment focusing on vital signs, neurological status, and potential signs of respiratory or cardiovascular compromise. This aligns with the CPAN certification's emphasis on advanced knowledge and skills in post-anesthesia care, ensuring adherence to established standards of practice and patient safety protocols. The nurse's responsibility extends to anticipating and managing potential complications, which requires a proactive and informed approach to patient monitoring and intervention. An incorrect approach that focuses solely on routine vital sign monitoring, without considering the specific anesthetic agents used, is professionally unacceptable. This failure to integrate pharmacological knowledge with patient assessment can lead to missed or delayed identification of adverse reactions, such as residual neuromuscular blockade or central nervous system depression, which are directly related to the anesthetic agents. This constitutes a breach of the professional standard of care, as it neglects a crucial element of post-anesthesia assessment. Another incorrect approach that involves administering reversal agents without a clear indication or physician order is also professionally unacceptable. This bypasses established protocols for medication administration and patient safety, potentially leading to adverse effects from the reversal agent itself or masking underlying issues that require different interventions. Such an action represents a significant ethical and regulatory failure, as it exceeds the nurse's scope of practice and jeopardizes patient well-being. A third incorrect approach that relies on anecdotal experience or the experience of colleagues without consulting current evidence-based guidelines or the patient's specific record is professionally unacceptable. While experience is valuable, it must be grounded in current scientific knowledge and institutional policies. Relying on outdated or unverified information can lead to suboptimal care and potential harm, failing to meet the professional obligation to provide evidence-based practice. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient data, including medical history, surgical procedure, and anesthetic agents used. 2. Perform a thorough physical and neurological assessment, correlating findings with expected effects of anesthetic agents. 3. Consult evidence-based guidelines and institutional protocols for post-anesthesia care. 4. Collaborate with the anesthesia provider and surgical team to address any concerns or deviations from expected recovery. 5. Document all assessments, interventions, and patient responses accurately. Question 5. The evaluation methodology shows a post-anesthesia care unit nurse is caring for a patient who received fentanyl during surgery. The patient is now exhibiting decreased level of consciousness, a respiratory rate of 8 breaths per minute, and shallow respirations. The nurse suspects opioid-induced respiratory depression. Which of the following actions is the most appropriate immediate intervention? Option A. Administer naloxone intravenously, titrating to effect. Option B. Increase the infusion rate of the fentanyl drip. Option C. Administer a respiratory stimulant medication. Option D. Continue to monitor the patient closely and wait for the anesthesiologist to arrive. Correct answer is A. Administer naloxone intravenously, titrating to effect. Explanation: scenario analysis. This scenario presents a common yet critical challenge in post-anesthesia care, managing opioid-induced respiratory depression. The nurse must rapidly assess the patient's condition, identify the likely cause of the altered mental status and decreased respiratory rate, and intervene appropriately while adhering to established protocols and physician orders. The challenge lies in balancing the need for effective pain management with the risk of serious adverse effects, requiring a nuanced understanding of opioid pharmacology and patient monitoring. Correct approach analysis. The correct approach involves recognizing the signs and symptoms suggestive of opioid toxicity, specifically respiratory depression, and initiating a prompt, evidence-based intervention. Administering naloxone, an opioid antagonist, directly addresses the underlying pharmacological issue by reversing the effects of the opioid. This action is supported by CPAN scope of practice guidelines and hospital protocols, which empower nurses to administer reversal agents in emergent situations when patient safety is compromised. The immediate administration of naloxone, titrated to effect, is the most direct and effective way to restore adequate ventilation and prevent further deterioration, aligning with the principle of beneficence and the duty to prevent harm. Incorrect approaches analysis. One incorrect approach involves waiting for the physician to be physically present before administering any intervention. While physician consultation is crucial, delaying life-saving treatment in a rapidly deteriorating patient constitutes a failure to act within the nurse's professional responsibility and potentially violates the principle of non-maleficence by allowing harm to progress. Another incorrect approach is to increase the opioid dosage to manage the patient's agitation, which would exacerbate the respiratory depression and opioid toxicity, directly contravening safe nursing practice and the understanding of opioid pharmacodynamics. Administering a respiratory stimulant without addressing the opioid overdose is also inappropriate, as it does not counteract the primary cause of the respiratory depression and could mask the severity of the situation. Professional reasoning. Professionals should employ a systematic approach to patient assessment, prioritizing immediate threats to life and safety. This involves recognizing early warning signs of adverse drug reactions, understanding the pharmacology of commonly administered medications, and knowing when and how to intervene autonomously or seek immediate assistance. Adherence to established protocols, critical thinking skills, and a commitment to patient advocacy are paramount in managing such high-stakes situations. The decision-making process should involve rapid assessment, identification of the problem, consideration of potential interventions based on evidence and scope of practice, and prompt implementation of the most effective and safest course of action. Question 6. The evaluation methodology shows that a certified post-anesthesia nurse, CPAN, is assessing a patient's recovery from general anesthesia. The patient exhibits fluctuating levels of consciousness, occasional disorientation, and mild tremors. Which of the following approaches best demonstrates the CPAN understanding of central nervous system structure and function in this post-anesthesia context? Option A. Focusing primarily on the patient's verbal complaints of discomfort and assessing vital signs for stability, assuming neurological changes are transient anesthetic side effects. Option B. Observing the patient's motor movements and noting the presence of tremors without considering their potential origin within the CNS or the impact of anesthesia on motor pathways. Option C. Correlating the patient's fluctuating consciousness and disorientation with the effects of anesthetic agents on the cerebral cortex and brainstem reticular activating system, and the tremors with potential cerebellar or basal ganglia involvement. Option D. Relying on the anesthesiologist's initial assessment and only intervening if the patient exhibits severe agitation or unresponsiveness, without independent neurological evaluation. The correct answer is C. Correlating the patient's fluctuating consciousness and disorientation with the effects of anesthetic agents on the cerebral cortex and brainstem reticular activating system, and the tremors with potential cerebellar or basal ganglia involvement. Explanation. The evaluation methodology shows that assessing a certified post-anesthesia nurse's, CPAN, understanding of central nervous system, CNS, structure and function is critical for safe patient care in the post-anesthesia period. This scenario is professionally challenging because the CNS is complex, and deviations from normal function can have profound and rapid impacts on a patient recovering from anesthesia. A CPAN must be able to differentiate between expected recovery patterns and signs of neurological compromise, which requires a deep understanding of neuroanatomy and physiology. Careful judgment is required to interpret subtle changes in neurological status and to intervene appropriately and promptly. The correct approach represents best professional practice because it directly aligns with the CPAN certification's core competencies, which emphasize the application of scientific principles to patient care. Understanding the specific roles of different CNS structures, e.g., brainstem, cerebral cortex, cerebellum, and their functions, e.g., consciousness, motor control, respiratory drive, allows the CPAN to anticipate potential anesthetic effects and complications. This knowledge is essential for accurate assessment, early detection of adverse events like emergence delirium, postoperative nausea and vomiting, PONV, with neurological components or signs of central nervous system depression, and for implementing evidence-based interventions. Adherence to these principles ensures patient safety and promotes optimal recovery, reflecting the CPAN commitment to high-quality, evidence-based nursing care as mandated by professional nursing standards and the CPAN certification body's guidelines. An incorrect approach that focuses solely on superficial signs without understanding the underlying CNS mechanisms fails to meet the standards of a CPAN. This represents a regulatory and ethical failure because it demonstrates a lack of the in-depth knowledge required to provide safe and effective post-anesthesia care. Such an approach could lead to delayed recognition of serious neurological issues, potentially resulting in patient harm and a breach of the nurse's duty of care. Another incorrect approach that relies on anecdotal evidence or outdated practices, rather than current scientific understanding of CNS function, also constitutes a failure. This violates the ethical obligation to provide care based on the best available evidence and professional standards, and it may contravene guidelines from professional organizations that emphasize continuous learning and evidence-based practice. The professional decision-making process for similar situations should involve a systematic approach. First, recognizing the patient's baseline neurological status. Second, understanding the expected neurological recovery trajectory based on the type of anesthesia and surgery. Third, performing a comprehensive neurological assessment, correlating observed signs and symptoms with specific CNS structures and functions. Fourth, differentiating between normal recovery phenomena and potential complications. And finally, implementing timely and appropriate interventions based on this analysis, while continuously reassessing the patient's response. This process is guided by the principles of patient safety, evidence-based practice, and professional accountability inherent in the CPAN role. Question 7. Investigation of a patient's renal system status in the post-anesthesia care unit, PACU, requires a CPAN to prioritize which of the following assessments to ensure optimal patient recovery and identify potential complications early. Option A. Comprehensive evaluation of urine output, vital signs, and fluid balance, correlating these with the patient's preoperative renal function and intraoperative fluid management. Option B. Delegating the primary assessment of urine output and vital signs to unlicensed assistive personnel without direct CPAN validation. Option C. Prioritizing pain management interventions exclusively, assuming adequate renal function if the patient reports pain relief. Option D. Sole reliance on the patient's subjective report of comfort and absence of flank pain to gauge renal well-being. The correct answer is A. Comprehensive evaluation of urine output, vital signs, and fluid balance, correlating these with the patient's preoperative renal function and intraoperative fluid management. Explanation. This scenario presents a professional challenge due to the critical nature of post-anesthesia care and the potential for rapid deterioration of renal function, which can significantly impact patient outcomes and recovery. A CPAN must possess a thorough understanding of renal anatomy and physiology to accurately assess, monitor, and intervene appropriately. The challenge lies in distinguishing between normal physiological responses to anesthesia and surgery and early signs of renal compromise, which requires a nuanced application of knowledge. The correct approach represents best professional practice because it directly addresses the core of post-anesthesia renal assessment by focusing on physiological indicators directly linked to kidney function and perfusion. This aligns with the CPAN scope of practice, which mandates the provision of safe and effective care based on scientific principles and evidence-based practice. Adhering to established protocols for post-anesthesia monitoring, including vigilant assessment of urine output, vital signs, and fluid balance, is paramount. This proactive and comprehensive evaluation ensures timely identification of potential complications, allowing for prompt intervention and minimizing the risk of adverse events, thereby upholding the ethical obligation to provide competent and compassionate care as outlined by nursing standards and regulatory bodies governing advanced practice nursing. An incorrect approach that relies solely on subjective patient reports without objective physiological data fails to meet the standard of care. Renal dysfunction is often insidious, and patients may not be able to articulate subtle changes. This approach neglects the CPAN responsibility to perform objective assessments and could lead to delayed diagnosis and treatment, potentially violating the duty of care. Another incorrect approach that focuses only on postoperative pain management without considering its potential impact on renal perfusion or the direct assessment of renal function is also professionally unacceptable. While pain management is crucial, it should not overshadow the comprehensive assessment required in the post-anesthesia period. Ignoring renal parameters could lead to undetected complications, such as acute kidney injury, which can have severe consequences. This oversight represents a failure to adhere to the holistic care principles expected of a CPAN. A third incorrect approach that delegates the primary responsibility of renal assessment to less experienced staff without direct oversight or validation by the CPAN is a significant ethical and professional lapse. While teamwork is essential, the ultimate accountability for patient assessment and care planning rests with the licensed professional. This delegation could lead to missed critical findings and compromised patient safety, violating professional standards of accountability and supervision. The professional decision-making process for similar situations should involve a systematic approach. First, a thorough review of the patient's preoperative status, intraoperative course, and anesthetic agents used. Second, a comprehensive postoperative assessment focusing on vital signs, fluid balance, urine output, and signs of hypoperfusion. Third, correlation of findings with known physiological responses to anesthesia and surgery. And fourth, prompt communication with the anesthesia provider and physician for any concerning deviations from baseline or expected recovery, ensuring a collaborative and patient-centered approach. Question 8. What factors determine the potential for synergistic or antagonistic drug interactions in a post-anesthesia patient, impacting their physiological response and recovery trajectory? Option A. The perceived severity of the patient's symptoms and the duration of the surgical procedure. Option B. The patient's reported pain level and the nurse's familiarity with common postoperative medications. Option C. The chronological order in which medications were administered and the availability of standard postoperative order sets. Option D. The specific receptor binding affinities of co-administered drugs, their metabolic pathways, and the patient's individual physiological status. Correct answer is D. The specific receptor binding affinities of co-administered drugs, their metabolic pathways, and the patient's individual physiological status. Explanation. This scenario is professionally challenging because post-anesthesia care involves managing patients with complex physiological states and multiple potential drug interactions. The nurse must anticipate and mitigate risks associated with pharmacodynamic principles in a dynamic patient environment. Careful judgment is required to ensure patient safety and optimize recovery. The correct approach represents best professional practice because it directly addresses the core principles of pharmacodynamics relevant to post-anesthesia care. Understanding how drugs interact with the body and with each other is fundamental to predicting and managing patient responses, preventing adverse events, and ensuring appropriate therapeutic outcomes. This aligns with the CPAN certification's focus on specialized knowledge and skills in post-anesthesia nursing, emphasizing evidence-based practice and patient safety. Adherence to established nursing standards of practice and scope of practice, which implicitly require this level of understanding, is also a key ethical and regulatory consideration. An incorrect approach that focuses solely on the patient's subjective complaints without considering underlying pharmacodynamic interactions would be professionally unacceptable. This failure would violate the ethical principle of beneficence by not adequately addressing potential physiological causes of distress and could lead to delayed or inappropriate interventions. It also represents a failure to adhere to professional standards of care, which mandate a comprehensive assessment that includes understanding drug effects. Another incorrect approach that prioritizes routine postoperative protocols over individualized pharmacodynamic assessment would be professionally unacceptable. This rigid adherence to protocol, without considering the unique drug regimen and patient physiology, could lead to overlooking critical drug-drug or drug-receptor interactions, potentially resulting in adverse events. This demonstrates a lack of critical thinking and a failure to apply specialized knowledge, which is a cornerstone of professional nursing practice and CPAN certification. A third incorrect approach that relies on anecdotal evidence or personal experience rather than established pharmacodynamic principles would be professionally unacceptable. This approach lacks the scientific rigor required for safe and effective patient care. It deviates from evidence-based practice, a fundamental ethical and professional obligation, and increases the risk of patient harm due to unvalidated interventions. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive patient assessment, including a thorough review of all medications administered and their known pharmacodynamic profiles. 2. Identification of potential drug interactions based on known mechanisms of action and receptor binding. 3. Prediction of potential patient responses and adverse effects. 4. Development of a targeted monitoring plan and intervention strategy based on these predictions. 5. Continuous reassessment and adjustment of the plan as the patient's condition evolves. This process ensures that care is individualized, evidence-based, and focused on patient safety. Question 9. When evaluating a patient who underwent a minor surgical procedure under general anesthesia and was initially designated for outpatient discharge, but now exhibits persistent nausea, significant dizziness, and a blood pressure reading at the lower end of the acceptable range, which of the following best reflects the appropriate post-anesthesia care management decision? Option A. Discharge the patient with instructions for immediate follow-up with their primary care physician within 24 hours to address the persistent symptoms. Option B. Transfer the patient directly to a general ward without further specialized post-anesthesia monitoring, assuming their condition is stable enough for routine nursing care. Option C. Continue inpatient observation and management until the patient's symptoms resolve and vital signs stabilize within acceptable parameters, necessitating a reassessment of their discharge readiness. Option D. Proceed with outpatient discharge as originally planned, advising the patient to manage symptoms at home with prescribed antiemetics and rest. The correct answer is C. Continue inpatient observation and management until the patient's symptoms resolve and vital signs stabilize within acceptable parameters, necessitating a reassessment of their discharge readiness. Explanation. This scenario presents a professional challenge because the nurse must apply nuanced judgment to determine the most appropriate post-anesthesia care pathway for a patient transitioning from outpatient to inpatient status, considering the inherent differences in monitoring intensity, discharge criteria, and potential for complications. The decision requires a thorough understanding of the patient's individual risk factors, the type of anesthesia administered, and the expected recovery trajectory, all within the framework of established post-anesthesia care standards. The correct approach represents best professional practice because it prioritizes patient safety and optimal recovery by ensuring that the patient receives the appropriate level of care based on their evolving clinical status. This aligns with the core ethical principles of beneficence and non-maleficence, as well as regulatory guidelines that mandate individualized care plans and vigilant monitoring. By recognizing the need for a higher level of observation and intervention when a patient's recovery deviates from the expected outpatient trajectory, the nurse demonstrates a commitment to preventing adverse events and facilitating a smooth transition to inpatient care. This proactive stance is crucial in post-anesthesia nursing, where subtle changes can indicate significant complications. An incorrect approach that fails to escalate care when a patient is no longer suitable for outpatient discharge criteria represents a significant regulatory and ethical failure. This could lead to premature discharge, inadequate monitoring, and an increased risk of post-operative complications, potentially violating standards of care and patient safety regulations. Another incorrect approach, such as unnecessarily prolonging inpatient observation for a patient who has clearly met outpatient discharge criteria, could lead to inefficient resource utilization and potentially delay the patient's return home, impacting their comfort and well-being without a clear clinical benefit. This might also be seen as a failure to adhere to established discharge protocols and efficient patient flow. The professional decision-making process for similar situations should involve a systematic assessment of the patient's vital signs, pain level, nausea and vomiting, mobility, and overall mental status. This assessment should be compared against established discharge criteria for outpatient procedures. If the patient fails to meet any of these criteria, or if there is any concern about their stability or ability to manage at home, the nurse must advocate for a higher level of care, such as continued inpatient observation. This involves clear communication with the anesthesia provider and surgical team to ensure a collaborative and informed decision regarding the patient's disposition. Question 10. The evaluation methodology shows that a patient recovering from an abdominal surgical procedure is exhibiting mild abdominal distension and absent bowel sounds in the lower quadrants. The patient denies significant pain, but reports feeling bloated. Considering the anatomy and physiology of the gastrointestinal system and the potential impact of anesthesia and surgery, which of the following nursing actions best reflects appropriate post-anesthesia care? Option A. Encourage the patient to ambulate frequently to stimulate bowel activity and administer a prescribed stool softener. Option B. Document the findings and continue routine post-operative monitoring, assuming the symptoms will resolve spontaneously. Option C. Notify the anesthesia provider or surgeon of the findings, including the absent bowel sounds and abdominal distension, to facilitate further assessment and management. Option D. Administer prescribed opioid analgesics for pain and continue routine monitoring of vital signs. The correct answer is D. Administer prescribed opioid analgesics for pain and continue routine monitoring of vital signs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to integrate knowledge of gastrointestinal anatomy and physiology with the immediate post-operative needs of a patient. The challenge lies in recognizing subtle signs of potential gastrointestinal compromise that may not be immediately obvious, but can have significant implications for patient recovery and safety. Accurate assessment and timely intervention are paramount to prevent complications such as ileus, aspiration, or electrolyte imbalances. Correct approach analysis. The correct approach involves a comprehensive assessment that directly correlates observed patient signs and symptoms with expected post-operative gastrointestinal function based on the patient's surgical procedure and anesthetic management. This approach aligns with the CPAN scope of practice, which mandates the provision of safe, individualized, and evidence-based care. Specifically, it requires the nurse to understand that abdominal surgery or certain anesthetic agents can directly impact bowel motility. Therefore, monitoring for bowel sounds, abdominal distension, nausea, vomiting, and the passage of flatus or stool is critical. This proactive assessment allows for early identification of deviations from normal recovery, enabling prompt reporting to the anesthesia provider or surgeon, and facilitating appropriate management strategies, thereby upholding the standard of care and patient advocacy as outlined by professional nursing organizations and regulatory bodies governing post-anesthesia care. Incorrect approach is analysis. One incorrect approach is to solely focus on vital signs and pain management, neglecting specific gastrointestinal assessments. This fails to meet the standard of care because it overlooks a critical system that is frequently affected by anesthesia and surgery. Ethically, this approach could be considered negligent as it deviates from the expected comprehensive post-operative assessment, potentially leading to delayed diagnosis and treatment of gastrointestinal complications. Another incorrect approach is to assume normal gastrointestinal function based on the absence of overt complaints of nausea or vomiting. This is flawed because patients may not always articulate their discomfort or early signs of ileus, such as absent bowel sounds or increasing distension, may precede subjective symptoms. This approach violates the principle of thorough assessment and could lead to adverse patient outcomes, contravening professional nursing responsibilities. A third incorrect approach is to attribute any abdominal discomfort solely to surgical pain, without considering other potential gastrointestinal etiologies. While pain is a common post-operative issue, it is crucial to differentiate it from symptoms indicative of a developing gastrointestinal problem. This limited diagnostic perspective can delay necessary interventions, potentially exacerbating a condition like bowel obstruction or paralytic ileus, which is a failure to provide holistic and accurate patient care. Professional reasoning. Professionals should employ a systematic and comprehensive post-anesthesia assessment framework. This framework should include a detailed review of the surgical procedure, anesthetic agents used, and anticipated physiological effects. For the gastrointestinal system, this means actively assessing for bowel sounds in all four quadrants, palpating for distension and tenderness, inquiring about nausea and vomiting, and monitoring for the passage of flatus or stool. Any deviations from the patient's baseline or expected recovery trajectory should be meticulously documented and promptly communicated to the appropriate healthcare provider. This decision-making process emphasizes critical thinking, vigilant observation, and effective communication to ensure optimal patient outcomes and adherence to regulatory and ethical standards. Question 11. Compliance review shows that a patient scheduled for elective surgery has a history of mild asthma and is taking an over-the-counter antihistamine for seasonal allergies. During the preoperative assessment, the certified post-anesthesia nurse, CPAN, reviews the patient's chart, notes the surgeon's brief assessment, and asks the patient if they have any other medical conditions. The patient states they feel fine. Which of the following actions by the CPAN best ensures a safe and effective preoperative assessment? Option A. Advise the patient to discontinue the antihistamine immediately and reschedule the surgery if they have any concerns about their asthma. Option B. Rely on the anesthesia provider to conduct a thorough respiratory assessment during the intraoperative period. Option C. Inquire further about the specific type of antihistamine, its dosage, and the last time it was taken, and perform a focused respiratory assessment including auscultation of lung sounds and assessment of respiratory rate and effort. Option D. Document the patient's statement of feeling fine and proceed with the assessment, assuming the surgeon's notes are comprehensive. The correct answer is C. Inquire further about the specific type of antihistamine, its dosage, and the last time it was taken, and perform a focused respiratory assessment including auscultation of lung sounds and assessment of respiratory rate and effort. Explanation. This scenario presents a professional challenge due to the critical nature of preoperative assessment in ensuring patient safety and optimizing post-anesthesia care. The certified post-anesthesia nurse, CPAN, must synthesize complex patient information, identify potential risks, and communicate these effectively to the anesthesia provider. Failure to conduct a thorough and accurate preoperative assessment can lead to unforeseen complications during and after anesthesia, impacting patient outcomes and potentially violating professional standards of care. The correct approach involves a comprehensive history and physical examination that goes beyond a superficial review. This includes eliciting detailed information about the patient's medical history, current medications, allergies, previous anesthetic experiences, and any relevant social history, e.g., smoking, alcohol use. The physical examination should focus on systems pertinent to anesthesia and surgery, such as the airway, cardiovascular, and respiratory systems. This thoroughness is paramount because it allows the CPAN to identify contraindications to certain anesthetic techniques, anticipate potential airway difficulties, recognize patients at higher risk for nausea and vomiting, and flag individuals who may require closer monitoring postoperatively. Adherence to established CPAN scope of practice guidelines and facility policies, which mandate such comprehensive assessments, is a fundamental ethical and professional obligation. This proactive identification of risks enables the anesthesia provider to tailor the anesthetic plan appropriately, thereby minimizing perioperative morbidity and mortality. An incorrect approach would be to rely solely on the surgeon's preoperative notes without independently verifying critical information. This is a regulatory and ethical failure because the CPAN has a distinct responsibility to conduct their own assessment and cannot delegate this fundamental duty. The surgeon's notes may not capture all the nuances relevant to anesthesia and post-anesthesia care, such as subtle changes in the patient's condition since the surgeon's last evaluation or specific details about prior anesthetic reactions. Another incorrect approach is to perform a cursory physical examination, focusing only on obvious abnormalities. This fails to meet the standard of care because it overlooks potential silent comorbidities or risk factors that could significantly impact the patient's recovery. For instance, a mild respiratory distress or subtle cardiac murmur might be missed, leading to an inadequate anesthetic plan and increased postoperative complications. Furthermore, neglecting to inquire about specific patient concerns or anxieties related to anesthesia and surgery represents an ethical lapse in patient advocacy and communication, potentially leading to increased patient distress and non-compliance with post-operative instructions. The professional decision-making process for similar situations should involve a systematic approach. First, understanding the patient's baseline health status through a detailed history. Second, performing a targeted physical examination to confirm and expand upon historical findings. Third, critically analyzing the gathered data to identify potential anesthetic and surgical risks. And fourth, communicating these findings and concerns clearly and concisely to the anesthesia provider, advocating for the patient's safety and optimal care throughout the perioperative period. This process is guided by evidence-based practice, professional standards, and a commitment to patient-centered care. Question 12. Quality control measures reveal a pattern of varying approaches to patient emergence from general anesthesia. A certified post-anesthesia nurse, CPAN, is reviewing cases where patients are being extubated. Which of the following approaches to managing emergence from general anesthesia best aligns with current best practices and regulatory expectations for CPAN? Option A. Delaying extubation until the patient is fully awake and can verbally respond to all commands, even if spontaneous respiration is robust and airway reflexes are intact. Option B. Extubating the patient once the anesthetic agent is discontinued and the patient begins to stir, without a detailed assessment of spontaneous respiratory effort or airway reflexes. Option C. Proceeding with extubation based on the surgeon's request, irrespective of the patient's current level of consciousness or physiological readiness. Option D. Performing a comprehensive assessment of the patient's respiratory status, including spontaneous tidal volume and respiratory rate, neurological responsiveness, and hemodynamic stability, to ensure readiness for extubation and safe emergence. The correct answer is B. Extubating the patient once the anesthetic agent is discontinued and the patient begins to stir, without a detailed assessment of spontaneous respiratory effort or airway reflexes. Explanation: this scenario is professionally challenging due to the critical nature of patient safety during the transition from general anesthesia to consciousness. The nurse must accurately assess the patient's readiness for extubation and subsequent recovery, balancing the need for timely extubation with the risks of airway compromise or inadequate pain control. Careful judgment is required to interpret subtle physiological and neurological cues. The correct approach represents best professional practice by prioritizing a systematic and evidence-based assessment of the patient's recovery from general anesthesia. This aligns with the certified post-anesthesia nurse, CPAN, role, which emphasizes the safe and effective management of patients in the post-anesthesia period. Specifically, it involves a comprehensive evaluation of respiratory function, neurological status, and hemodynamic stability, ensuring the patient meets established criteria for extubation and is prepared for the emergence phase. This proactive and thorough assessment minimizes the risk of adverse events such as airway obstruction, hypoxemia, or emergence delirium, thereby upholding the standard of care and patient well-being. An incorrect approach that involves extubating the patient solely based on the cessation of anesthetic agent administration, without a thorough assessment of spontaneous respiration, tidal volume, and airway reflexes, represents a significant regulatory and ethical failure. It bypasses critical safety checks mandated by post-anesthesia care standards, potentially leading to airway compromise and respiratory distress. Another incorrect approach, such as delaying extubation until the patient is fully awake and able to follow commands, can prolong the period of airway manipulation and increase the risk of laryngospasm or aspiration, also contravening best practices for timely and safe emergence. Furthermore, failing to adequately assess pain and nausea before extubation can lead to patient distress and agitation during emergence, impacting the overall recovery experience and potentially leading to adverse physiological responses. The professional decision-making process for similar situations should involve a structured approach. 1. Review the patient's anesthetic record and surgical procedure to anticipate potential complications. 2. Continuously monitor vital signs and patient status throughout the emergence process. 3. Apply established post-anesthesia care protocols and criteria for extubation readiness. 4. Communicate effectively with the anesthesia provider regarding the patient's progress. 5. Document all assessments and interventions meticulously. This systematic process ensures that all critical aspects of patient recovery are addressed, promoting a safe and optimal outcome. Question 13. Stakeholder feedback indicates a need to reinforce best practices in post-anesthesia pain management. A patient recovering from a laparoscopic cholecystectomy reports moderate, sharp abdominal pain. The patient has a history of mild gastritis and is not currently taking any anticoagulants. The anesthesia provider has ordered a non-opioid analgesic. Which of the following actions best reflects a safe and effective approach to managing this patient's pain? Option A. Administering a non-steroidal anti-inflammatory drug, NSAID, such as ibuprofen, after confirming the patient has no contraindications to NSAID and considering the potential for gastrointestinal irritation given their history of gastritis. Option B. Administering a non-opioid analgesic that has not been specifically ordered, based on the nurse's personal preference for pain relief. Option C. Administering a topical analgesic cream to the abdominal area without assessing the patient's pain level or the suitability of topical agents for this type of surgical pain. Option D. Administering acetaminophen at the maximum recommended dose without further assessment, assuming it is universally safe for all postoperative pain. The correct answer is A. Administering a non-steroidal anti-inflammatory drug, NSAID, such as ibuprofen, after confirming the patient has no contraindications to NSAID and considering the potential for gastrointestinal irritation given their history of gastritis. Explanation: this scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to critically evaluate and select appropriate non-opioid analgesics for a patient experiencing moderate postoperative pain, while adhering to established clinical guidelines and the specific regulatory framework governing their practice. The challenge lies in balancing patient comfort with the safe and effective use of medications, considering potential contraindications, drug interactions, and the evolving pain management landscape. Careful judgment is required to ensure patient safety and optimize pain relief without unnecessary reliance on opioids. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's pain, medical history, and potential contraindications before selecting a non-opioid analgesic. This aligns with the core principles of patient-centered care and evidence-based practice, which are fundamental to the CPAN role. Specifically, it reflects adherence to guidelines that emphasize a multimodal approach to pain management, starting with non-opioid options when appropriate. The selection of an NSAID, considering renal function and gastrointestinal history, demonstrates a thorough understanding of pharmacodynamics and pharmacokinetics, ensuring the chosen medication is both effective and safe for the individual patient. This proactive approach minimizes the risk of adverse events and promotes optimal recovery, directly supporting the CPAN responsibility to provide high-quality post-anesthesia care. An incorrect approach that involves administering a non-opioid analgesic without a thorough patient assessment fails to meet the standard of care. This could lead to adverse drug reactions, exacerbation of pre-existing conditions, or ineffective pain management. For instance, administering an NSAID to a patient with a history of peptic ulcers or renal insufficiency without proper consideration would violate ethical obligations to do no harm and could contraindicate specific drug classes based on patient factors. Another incorrect approach, such as defaulting to a higher dose of a non-opioid analgesic without considering the patient's pain severity or response to previous treatments, demonstrates a lack of critical thinking and adherence to principles of safe medication titration. This could result in unnecessary side effects or mask the need for alternative or adjunctive pain management strategies. A further incorrect approach, such as administering a non-opioid analgesic that has known interactions with the patient's current medications without consulting a pharmacist or physician, poses a significant risk of adverse drug events and contravenes the nurse's responsibility to maintain accurate medication reconciliation and patient safety. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough patient assessment, including pain assessment, vital signs, medical history, allergies, and current medications. Second, consult relevant clinical practice guidelines and institutional protocols for post-anesthesia pain management. Third, identify appropriate non-opioid analgesic options based on the patient's condition and pain severity. Fourth, evaluate the risks and benefits of each potential medication, considering contraindications, drug interactions, and patient-specific factors. Fifth, select the most appropriate analgesic and administer it according to the prescribed dosage and route, while continuously monitoring the patient's response and for any adverse effects. Finally, document the assessment, intervention, and patient response accurately and comprehensively. Question 14. The efficiency study reveals that the current post-anesthesia care protocol for patients receiving regional anesthesia, specifically spinal and epidural techniques, may not adequately address the unique risks associated with these modalities. Which of the following approaches to post-anesthesia assessment and care best aligns with the principles of risk assessment and patient safety in this context? Option A. Implementing a standardized, comprehensive assessment that includes detailed monitoring of vital signs, neurological function, and specific signs of potential complications related to spinal and epidural anesthesia, such as hypotension, motor/sensory block regression, and urinary retention. Option B. Focusing the assessment on the surgical procedure performed, with minimal specific attention to the anesthetic technique unless the patient expresses significant discomfort. Option C. Relying primarily on routine vital sign checks at prescribed intervals, assuming that the absence of overt distress indicates a stable recovery from regional anesthesia. Option D. Conducting a brief assessment for basic comfort and vital signs, with the expectation that any significant issues will be reported by the patient or the anesthesia provider. Correct answer is A. Implementing a standardized, comprehensive assessment that includes detailed monitoring of vital signs, neurological function, and specific signs of potential complications related to spinal and epidural anesthesia, such as hypotension, motor/sensory block regression, and urinary retention. Explanation. This scenario presents a professional challenge due to the inherent risks associated with regional anesthesia, specifically spinal and epidural techniques, and the critical need for vigilant post-anesthesia care. The certified post-anesthesia nurse, CPAN, must possess a comprehensive understanding of potential complications, patient monitoring parameters, and appropriate interventions to ensure patient safety and optimal recovery. The efficiency study highlights a potential gap in the standardized assessment of patients receiving these types of anesthesia, necessitating a risk-based approach to care delivery. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established nursing standards of care for post-anesthesia patients receiving regional anesthesia. This involves a systematic and thorough assessment of vital signs, neurological status, and potential complications such as hypotension, bradycardia, respiratory depression, and urinary retention, all of which are common risks associated with spinal and epidural anesthesia. Adherence to CPAN certification standards and relevant professional guidelines, e.g., ASPAN standards for post-anesthesia care, mandates this level of vigilance and individualized care planning. An incorrect approach that focuses solely on routine vital sign checks without specific consideration for the nuances of regional anesthesia would be professionally unacceptable. This failure would violate the ethical obligation to provide competent and individualized care, potentially leading to delayed recognition and management of serious complications. Such an approach could also contravene regulatory requirements for post-anesthesia care, which expect nurses to be knowledgeable about specific anesthetic modalities and their associated risks. Another incorrect approach that neglects to assess for signs of local anesthetic systemic toxicity, LAST, would also be a significant professional failure. LAST is a potentially life-threatening complication of regional anesthesia, and its early detection is paramount. Failing to monitor for symptoms like central nervous system excitation or depression, cardiovascular changes, or seizures would represent a breach of the standard of care and could have severe consequences for the patient. A third incorrect approach that relies on assumptions about patient recovery based on the type of surgery rather than the type of anesthesia would be equally problematic. While surgical factors influence recovery, the anesthetic technique itself carries distinct risks that require specific monitoring and management strategies. Ignoring these anesthetic-specific risks would be a failure to provide comprehensive post-anesthesia care. The professional decision-making process for similar situations should involve a thorough pre-anesthesia assessment, a clear understanding of the anesthetic agents and techniques used, and a proactive risk assessment for potential complications. This includes anticipating and monitoring for specific adverse events related to regional anesthesia, implementing appropriate interventions, and documenting all assessments and actions meticulously. Continuous learning and adherence to professional standards are crucial for maintaining competence in managing patients receiving regional anesthesia. Question 15. Process analysis reveals that a certified post-anesthesia nurse, CPAN, is caring for a patient who has just arrived in the post-anesthesia care unit, PACU, following a minor surgical procedure. The patient is awake but appears restless and anxious. The physician's orders include a PRN, as needed dose of a benzodiazepine for anxiety. The CPAN notes that the patient's vital signs are stable and their pain score is low. Considering the classifications and applications of sedatives and anxiolytics in the post-anesthesia setting, which of the following actions best reflects adherence to regulatory requirements and best professional practice? Option A. Document the availability of the PRN anxiolytic but wait to administer it until the patient explicitly requests it. Option B. Administer a non-pharmacological intervention, such as deep breathing exercises, and document this as the primary management for anxiety. Option C. Assess the patient's level of anxiety, review the medication's classification and potential side effects, and consult with the prescribing physician if the order appears questionable based on the patient's current status. Option D. Administer the prescribed benzodiazepine immediately to alleviate the patient's anxiety and restlessness. Correct answer is D. Administer the prescribed benzodiazepine immediately to alleviate the patient's anxiety and restlessness. Explanation: this scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to critically evaluate the appropriateness of a sedative and anxiolytic prescription in the immediate post-operative period, considering patient safety, regulatory compliance, and evidence-based practice. The CPAN must balance the physician's order with their professional responsibility to advocate for the patient and ensure safe medication administration. The correct approach represents best professional practice because it prioritizes patient assessment and adherence to established protocols for medication administration and patient monitoring in the post-anesthesia care unit, PACU. This aligns with the core principles of nursing practice, which emphasize patient advocacy, safe medication management, and continuous assessment of patient response to interventions. Specifically, it upholds the regulatory framework that mandates nurses to assess patients before administering medications, monitor for adverse effects, and question orders that appear inappropriate or potentially harmful. This proactive approach ensures that the patient receives the most appropriate care and minimizes the risk of adverse events, thereby adhering to standards of care and professional accountability. An incorrect approach that involves administering the medication without further assessment or questioning the order fails to meet the professional and regulatory obligations of a CPAN. This could lead to adverse drug events, such as excessive sedation, respiratory depression, or paradoxical reactions, which could compromise patient safety and result in a breach of the standard of care. Such an action would violate regulations requiring nurses to exercise independent judgment and to report any concerns about medication orders. Another incorrect approach, such as immediately discontinuing the medication without consulting the prescribing physician, bypasses the established chain of command and may be premature without a thorough assessment. While patient safety is paramount, unilateral decisions to alter or stop prescribed treatments can have negative consequences and may not be within the nurse's scope of practice without further investigation and communication. This could lead to a breakdown in the therapeutic relationship with the physician and potentially compromise the patient's pain management or anxiety control if the medication was indeed indicated. A further incorrect approach, such as documenting the administration of the medication without verifying its appropriateness or the patient's response, constitutes a failure in accurate record-keeping and patient monitoring. This not only misrepresents the patient's care, but also hinders effective communication among the healthcare team, potentially leading to delayed recognition of complications or inappropriate continuation of therapy. This directly contravenes regulatory requirements for accurate and timely documentation of patient care. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly assess the patient's current condition, including vital signs, level of consciousness, pain score, and any signs of anxiety or distress. Second, review the medication order, considering the drug's classification, intended effect, typical dosage ranges, and potential side effects in the post-anesthesia context. Third, consult relevant institutional policies and procedures regarding sedative and anxiolytic administration in the PACU. Fourth, if any concerns arise regarding the appropriateness of the order, communicate these concerns clearly and professionally to the prescribing physician, providing objective data from the patient assessment. Finally, document all assessments, communications, and interventions accurately. Question 16. The risk matrix shows a moderate likelihood of postoperative musculoskeletal complications, including nerve compression and muscle strain, due to prolonged positioning during lengthy surgical procedures. As a certified post-anesthesia nurse, CPAN, which of the following actions best demonstrates adherence to the regulatory framework and ethical guidelines for managing such risks in the immediate post-anesthesia period? Option A. Conduct a thorough neurological and muscular assessment, including evaluation of motor strength, sensation, and range of motion in all affected extremities, and promptly report any deviations from baseline or concerning findings to the anesthesia provider. Option B. Document the patient's general postoperative pain score and administer prescribed analgesics, deferring a detailed musculoskeletal examination until the patient is transferred to the surgical ward. Option C. Rely on the patient's verbal report of discomfort to gauge the severity of any potential musculoskeletal issues, assuming that most postoperative pain is typical and will resolve with routine analgesia. Option D. Monitor vital signs and administer prescribed medications for pain, assuming that any observed limb weakness or altered sensation is a transient effect of residual anesthesia and will resolve without specific intervention. The correct answer is A. Conduct a thorough neurological and muscular assessment, including evaluation of motor strength, sensation, and range of motion in all affected extremities, and promptly report any deviations from baseline or concerning findings to the anesthesia provider. Explanation. This scenario presents a professional challenge due to the inherent variability in patient responses to anesthesia and surgery, particularly concerning the musculoskeletal system. Post-anesthesia nurses must possess a deep understanding of musculoskeletal anatomy and physiology to anticipate, identify, and manage potential complications. The challenge lies in differentiating normal recovery from pathological conditions that may manifest as musculoskeletal issues, such as nerve injury, compartment syndrome, or rhabdomyolysis, all of which can be exacerbated by positioning during surgery or prolonged immobility. Careful judgment is required to assess subtle changes in motor function, sensation, and muscle integrity. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the patient's musculoskeletal status. This aligns with the CPAN certification's emphasis on specialized post-anesthesia care and the ethical obligation to provide safe and effective patient care. Adhering to established protocols for postoperative musculoskeletal assessment, which include evaluating range of motion, muscle strength, sensation, and skin integrity, is crucial. Promptly reporting any deviations from baseline or expected findings to the anesthesia provider or surgeon is a critical step in preventing adverse outcomes and ensuring timely intervention, thereby upholding the standards of care expected of a certified post-anesthesia nurse. An incorrect approach that focuses solely on superficial pain assessment without a thorough neurological and muscular evaluation would be professionally unacceptable. This failure would violate the ethical principle of beneficence by not adequately addressing potential underlying musculoskeletal pathology. It could also lead to a breach of the standard of care, as it neglects a systematic assessment of a system known to be vulnerable in the postoperative period. Another incorrect approach, such as delaying reporting of concerning findings due to a belief that the patient will spontaneously improve, demonstrates a lack of understanding of the potential for rapid deterioration in certain musculoskeletal conditions. This delay could constitute negligence, as it fails to act in a timely manner to prevent harm, violating the ethical duty of non-maleficence. A third incorrect approach, relying solely on patient self-reporting of symptoms without objective physical assessment, is also professionally unacceptable. While patient input is vital, it must be corroborated by objective findings. This approach risks overlooking objective signs of serious musculoskeletal compromise that the patient may not be able to articulate or may attribute to general postoperative discomfort. This failure to conduct a comprehensive assessment could lead to misdiagnoses and delayed treatment, contravening professional standards. The professional decision-making process for similar situations should involve a systematic approach. First, recall and apply knowledge of musculoskeletal anatomy and physiology relevant to the surgical procedure and anesthetic used. Second, perform a comprehensive post-anesthesia assessment, including specific evaluation of the musculoskeletal system. Third, compare current findings with the patient's preoperative baseline and expected postoperative recovery. Fourth, critically analyze any deviations, considering potential causes and their severity. Finally, communicate findings and concerns clearly and promptly to the appropriate healthcare provider, advocating for the patient's needs based on objective data and professional judgment. Question 17. Process analysis reveals a post-anesthesia patient is exhibiting shallow respirations, a respiratory rate of 10 breaths per minute, and mild cyanosis around the lips. The patient is groggy but rousable to painful stimuli. The certified post-anesthesia nurse, CPAN, must determine the most appropriate initial intervention to address the patient's respiratory status. Option A. Prepare for immediate intubation and mechanical ventilation. Option B. Document the findings and continue to monitor the patient's oxygen saturation closely. Option C. Administer a prescribed opioid analgesic to manage any potential pain contributing to shallow breathing. Option D. Elevate the head of the bed and gently stimulate the patient to encourage deeper breaths. Correct answer is D. Elevate the head of the bed and gently stimulate the patient to encourage deeper breaths. Explanation. This scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to integrate knowledge of respiratory anatomy and physiology with the immediate needs of a post-operative patient exhibiting signs of respiratory compromise. The CPAN must make rapid, informed decisions based on subtle physiological cues, prioritizing patient safety and adherence to established post-anesthesia care standards. The challenge lies in accurately interpreting the patient's respiratory status and selecting the most appropriate intervention from a range of possibilities, all while considering the patient's unique surgical and anesthetic history. The correct approach represents best professional practice because it directly addresses the most critical physiological deficit identified: impaired gas exchange due to potential airway obstruction or hypoventilation. By focusing on optimizing oxygenation and ventilation through interventions like positioning and stimulation, the CPAN is acting in accordance with the fundamental principles of post-anesthesia care, which emphasize the immediate stabilization of the patient's airway, breathing, and circulation, ABCs. This aligns with the CPAN certification's emphasis on the comprehensive management of the post-anesthesia patient, including the recognition and management of respiratory complications. Adherence to evidence-based practice and the nursing process, assessment, diagnosis, planning, intervention, evaluation, is paramount. An incorrect approach that focuses solely on administering a sedative to manage patient agitation without first addressing the underlying respiratory distress represents a significant regulatory and ethical failure. This would violate the principle of do no harm by potentially exacerbating hypoventilation and hypoxia. It fails to recognize the primary problem and instead treats a symptom, which is contrary to sound clinical judgment and professional nursing standards. Another incorrect approach, such as delaying intervention until the patient's oxygen saturation drops below a critical threshold, is also professionally unacceptable. This passive approach ignores early warning signs and the CPAN responsibility to proactively manage potential complications. It demonstrates a failure to apply critical thinking and a lack of understanding of the rapid deterioration that can occur in post-anesthesia patients. This could be seen as a breach of the duty of care owed to the patient. A further incorrect approach, such as immediately escalating to a more invasive intervention like intubation without attempting less invasive measures, may be premature and unnecessary. While intubation is a vital tool, it carries its own risks and should be reserved for situations where less invasive methods have failed or are clearly insufficient. This approach demonstrates a lack of graduated intervention and potentially oversteps the immediate needs of the patient based on the presented signs. The professional decision-making process for similar situations should involve a systematic assessment of the patient's ABCs, a thorough review of the patient's history, anesthesia, surgery, pre-existing conditions, and the application of critical thinking skills to interpret physiological data. The CPAN should then formulate a prioritized plan of care, implementing interventions based on evidence and the patient's immediate needs, while continuously monitoring the patient's response and being prepared to escalate care as necessary. This iterative process ensures that the patient receives the most appropriate and timely care. Question 18. The audit findings indicate a pattern of post-anesthesia nurses questioning physician orders for pain management medications that appear to interfere with the body's natural stress hormone regulation, specifically cortisol levels, which are critical for post-operative recovery and immune function. A specific patient is experiencing delayed wound healing and increased susceptibility to infection, and the physician has ordered a medication that is known to suppress the hypothalamic pituitary adrenal (HPA) axis. As a certified post-anesthesia nurse, CPAN, what is the most appropriate course of action? Option A. Administer the medication as ordered and inform the physician of the concerns after the fact. Option B. Politely but firmly communicate concerns to the physician, citing the patient's condition and the physiological impact on the endocrine system, and request reconsideration of the order. Option C. Administer the medication as ordered and document the concerns in the patient's chart. Option D. Discuss the concerns with a colleague to seek their opinion before approaching the physician. The correct answer is C. Administer the medication as ordered and document the concerns in the patient's chart. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a physician's directive and a nurse's ethical and professional responsibility to advocate for patient safety, particularly when the directive may compromise optimal physiological recovery. The nurse must navigate the complexities of the endocrine system's role in post-anesthesia recovery and the potential consequences of inadequate management. Correct approach analysis. The correct approach prioritizes patient safety and evidence-based practice by advocating for the physician to reconsider the medication based on the patient's physiological status and the known impact of the endocrine system on recovery. This aligns with the CPAN scope of practice, which includes monitoring for and responding to physiological changes and upholding ethical principles of patient advocacy and beneficence. The Certified Post-Anesthesia Nurse (CPAN) certification implies adherence to standards of care that emphasize a thorough understanding of post-anesthesia physiological responses, including those related to the endocrine system. This approach demonstrates a commitment to the patient's well-being by ensuring that interventions are appropriate and support the body's natural recovery processes, which are significantly influenced by hormones like cortisol and insulin in the post-operative period. Incorrect approaches analysis. One incorrect approach involves blindly following the physician's order without questioning, even when it appears to contradict the patient's best interest or established post-anesthesia care principles. This fails to uphold the nurse's professional responsibility to assess, monitor, and advocate for the patient. It could lead to adverse outcomes by neglecting the endocrine system's critical role in stress response and metabolic regulation post-surgery. This approach violates the ethical principle of non-maleficence and potentially beneficence. Another incorrect approach is to implement the order and then document concerns without immediate proactive communication. This delays necessary intervention and advocacy, potentially allowing patient harm to occur or worsen. While documentation is crucial, it should follow, not precede, appropriate action and communication when patient safety is at risk. This approach demonstrates a lack of timely advocacy and may not fully meet the standards of care expected of a CPAN. A third incorrect approach is to discuss the concern with colleagues without directly addressing it with the physician or seeking clarification. While peer consultation can be valuable, it should not replace direct communication with the responsible physician when a patient's care is potentially compromised. This approach avoids direct responsibility and may not lead to the necessary adjustment in the medical plan, leaving the patient at risk. Professional reasoning. Professionals should employ a systematic approach to ethical dilemmas. This involves 1. Recognizing the ethical issue and the potential conflict. 2. Gathering relevant information, including patient assessment data and knowledge of the endocrine system's post-anesthesia physiology. 3. Identifying the ethical principles at stake, e.g., beneficent, non-maleficent patient advocacy. 4. Exploring alternative courses of action. 5. Evaluating the potential consequences of each action. 6. Choosing the best course of action based on professional standards, ethical principles, and patient well-being. 7. Implementing the chosen action and evaluating its effectiveness. In this case, direct, respectful communication with the physician, supported by clinical data and knowledge of endocrine physiology, is the most appropriate first step. Question 19. Stakeholder feedback indicates a need to reinforce the foundational anatomical knowledge CPAN utilized during immediate post-anesthesia recovery. Considering the critical nature of early post-operative assessment, which anatomical systems understanding is most paramount for a CPAN to prioritize when evaluating a patient for potential immediate life-threatening complications? Option A. The anatomy of the upper airway, including the pharynx, larynx, and trachea, and their susceptibility to obstruction. Option B. The anatomy of the musculoskeletal system, including bones, joints, and muscles, and their relevance to postoperative pain and mobility. Option C. The anatomy of the gastrointestinal tract, including the stomach and intestines, and their role in postoperative nausea and vomiting. Option D. The anatomy of the peripheral venous system, including the veins of the extremities, and their function in fluid and medication administration. The correct answer is A. The anatomy of the upper airway, including the pharynx, larynx, and trachea, and their susceptibility to obstruction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified post-anesthesia nurse, CPAN, to integrate foundational anatomical knowledge with the immediate needs of a patient recovering from anesthesia. The challenge lies in accurately identifying the anatomical structures that are most vulnerable to injury or dysfunction during the immediate post-anesthesia period, and understanding how these relate to common post-operative complications. This requires not just rote memorization of anatomy, but the ability to apply that knowledge in a dynamic clinical setting where patient status can change rapidly. Correct approach analysis. The correct approach emphasizes the CPAN responsibility to assess and manage potential airway compromise. This aligns directly with the critical role of the respiratory system in post-anesthesia recovery. Understanding the anatomy of the upper airway, including the pharynx, larynx, and trachea, is paramount. Knowledge of the tongue's tendency to fall back and obstruct the pharynx in a sedated or anesthetized patient, the function of the epiglottis, and the patency of the laryngeal inlet are essential for recognizing and intervening in potential airway emergencies. This proactive assessment and intervention directly supports patient safety and aligns with the CPAN scope of practice, which includes monitoring vital signs and managing immediate post-operative complications. The regulatory framework for CPAN, while not explicitly detailed here due to the prompt's constraints, universally mandates patient safety and competent clinical judgment, which are directly served by prioritizing airway assessment. Incorrect approaches analysis. Focusing solely on the gastrointestinal tract without considering immediate airway patency is an incorrect approach. While postoperative nausea and vomiting (PONV) are common, the immediate threat to life in the post-anesthesia period is typically airway obstruction or hypoxemia. Neglecting the airway in favor of managing PONV represents a failure to prioritize the most critical physiological functions. Prioritizing the assessment of peripheral venous access sites over airway patency is also an incorrect approach. While maintaining Roman IV access is important for fluid and medication administration, it is secondary to ensuring the patient can breathe effectively. A patent airway is a prerequisite for all other physiological functions and interventions. Concentrating exclusively on the musculoskeletal system and potential post-operative pain management without addressing immediate life-sustaining functions is another incorrect approach. While pain management is a crucial aspect of post-anesthesia care, it does not supersede the immediate need to ensure adequate oxygenation and ventilation. The musculoskeletal system's anatomy is less immediately critical to survival in the immediate post-anesthesia phase compared to the respiratory system. Professional reasoning. When faced with a post-anesthesia patient, the CPAN should employ a systematic approach that prioritizes life-sustaining functions. This begins with a rapid assessment of the ABCs: airway, breathing, circulation. For airway assessment, the CPAN must recall the anatomy of the upper airway and be vigilant for signs of obstruction, such as stridor, paradoxical chest movement, or desaturation. If airway compromise is suspected, immediate interventions such as head tilt chin lift or jaw thrust maneuvers, suctioning, or airway adjuncts should be considered. Following the ABCs, the CPAN then proceeds to assess circulation, neurological status, and other systems, including pain and gastrointestinal function, as appropriate for the patient's condition and the type of anesthesia received. This hierarchical approach ensures that the most critical physiological needs are addressed first, minimizing the risk of adverse outcomes. Question 20. The control framework reveals that a patient in the PACU is exhibiting signs of delayed awakening and mild respiratory depression following a general anesthetic. The anesthesia record indicates the use of sevoflurane and intravenous fentanyl. Which of the following nursing actions best reflects the CPAN role in managing this situation? Option A. Assess the patient's respiratory rate, depth, and oxygen saturation, and administer supplemental oxygen as prescribed, while continuously monitoring for improvement in level of consciousness and respiratory effort, and notifying the anesthesia provider of any significant changes or concerns. Option B. Administer naloxone to counteract the effects of fentanyl without consulting the anesthesia provider. Option C. Assume the patient is experiencing a surgical complication and immediately initiate a rapid response team activation. Option D. Administer a benzodiazepine to promote sedation and reduce anxiety, as this is a common postoperative intervention. The correct answer is A. Assess the patient's respiratory rate, depth, and oxygen saturation, and administer supplemental oxygen as prescribed, while continuously monitoring for improvement in level of consciousness and respiratory effort, and notifying the anesthesia provider of any significant changes or concerns. Explanation: this scenario is professionally challenging due to the critical nature of anesthetic agent selection and administration in the post-anesthesia care unit, PACU. CPAN are responsible for vigilant monitoring and prompt intervention, which requires a deep understanding of how different anesthetic agents affect patient recovery. The challenge lies in recognizing subtle signs of adverse reactions or prolonged effects that may be specific to the anesthetic agent used, and in differentiating these from other potential postoperative complications. Careful judgment is required to ensure patient safety and optimize recovery pathways. The correct approach represents best professional practice because it directly addresses the CPAN responsibility to assess the patient's response to the specific anesthetic agents administered. This aligns with the core principles of post-anesthesia nursing care, emphasizing individualized patient assessment and management based on pharmacological knowledge. Adhering to established protocols for PACU care, which are informed by evidence-based practice and regulatory guidelines for safe medication administration and patient monitoring, is paramount. This approach prioritizes patient safety by ensuring that the CPAN is actively evaluating the patient's physiological status in relation to the known effects and potential side effects of the anesthetic agents, allowing for timely and appropriate interventions. An incorrect approach that focuses solely on general postoperative vital signs without considering the specific anesthetic agents used is professionally unacceptable. This fails to acknowledge the unique pharmacological profiles of different anesthetics and their potential for varied recovery trajectories and adverse effects. It represents a regulatory failure by not adhering to the standard of care that mandates a thorough understanding of the patient's anesthetic history and its implications for PACU management. Ethically, it falls short of providing individualized care tailored to the patient's specific needs and risks. Another incorrect approach that involves administering reversal agents without a clear indication or physician's order is a significant regulatory and ethical failure. This constitutes practicing beyond the scope of the CPAN authority, potentially leading to dangerous drug interactions or adverse patient outcomes. It violates protocols for medication administration and patient safety, and demonstrates a lack of critical thinking and adherence to the established chain of command. A third incorrect approach that relies on assumptions about patient recovery based on the type of surgery alone, without considering the anesthetic agents, is also professionally unacceptable. While surgical factors influence recovery, the anesthetic agents play a direct and profound role in the immediate postoperative period. This approach ignores a critical component of patient assessment and management, potentially delaying the recognition of anesthetic-related complications. It represents a failure to meet the professional standard of care by not comprehensively evaluating all contributing factors to the patient's recovery status. Professionals should employ a decision-making framework that begins with a thorough review of the patient's anesthetic record, identifying all agents administered, dosages, and routes. This is followed by a systematic head-to-toe assessment, with a specific focus on signs and symptoms known to be associated with the administered agents, e.g., respiratory depression with opioids, emergence delirium with certain volatile agents, or prolonged motor block with local anesthetics. The CPAN should then compare these findings to expected recovery patterns and known side effects, consulting with the anesthesia provider or physician as needed for clarification, or to report any deviations from the norm. This iterative process of assessment, knowledge application, and communication ensures safe and effective patient care.